It's 8:12 Tuesday morning. We got 50 degrees, and in the house it is Dr. Bob Olivieri. Love having him in on Tuesdays. And hey, today's topic is I think something that might be of interest to a lot of people who are going to be scarfing down their Thanksgiving feast.
Yeah. That's why I decided to talk about this topic. We're going to talk about acid reflux.
Oh, my goodness.
Yeah, sure. If you're gobbling down all that delicious food, usually within a few hours, many of us in America are going to start to get a little bit of upset stomach, a little bit of reflux, and we're going to talk about some of the things that you can do, and what the problem actually is.
Yeah, I can never figure that out. I do occasionally get the acid reflux. Sometimes it's like, when you've eaten something bad, like a bunch of pizza or whatever. But then sometimes, like, I did a little acid reflux over the weekend, and it was I was just drinking orange juice. I'm like, come on, orange juice. That seems, I know it's acidic, but still, like,
well,
that's not that bad.
Yeah, the old but still, really, it comes into play there.
Yeah.
They talk about 10% of Americans actually have episodes of heartburn every single day, and 44% have symptoms at least once a month. So, I mean, it's an epidemic in America. And we're going to talk a little bit about the standard treatment, and then we're going to talk about really what actually causes this. So it's kind of, it's sad. Really, the question is, like, are there like millions of us born in America that have a genetic defect that produces too much stomach acid? No. That's not the situation. Do we have just an evolutionary design flaw that allows us to have like stomach acid back up into our esophagus and sometimes up into the throat? No, that's not what it is. And is our body lacking these powerful acid blocking drugs? And that's why we get it. That's not the reason either. A big problem with this, and really we're going to talk about like a three-step approach to doing it, is that what happens is in GERD, which stands for gastroesophageal reflux disease or heartburn, is affecting 25 to 30% of the population throughout the course of the year. That's epidemic, because if you think of the damage of what can actually happen when acid is going up into tissue that's really not designed to handle acid. Your stomach's designed to handle the acid. Right. It starts to actually scar that tissue. It starts to break it down, and our body has a remarkable capability of healing those tissues. But when it's continual over a period of time, a lot of really bad things begin to happen, and even things like cancers. Unfortunately, sadly, my brother died of esophageal cancer. Mm. So it's an epidemic, and how we're treating it is really a Band-Aid approach. So what I want to do is I want to talk a little bit about some of the things. The standard treatment primarily is to take a drug that will decrease the amount of acid that's in your stomach. So what happens is your stomach should be functioning. The purpose of your stomach is to have hydrochloric acid at right around the pH of like 2, very, very acidic, to be able to break down foods. So every single organ in our body has a purpose of what it's supposed to do. Our stomach is designed to break down really, really tough foods. We ingest primarily 3 primary food groups: carbohydrates, fats, and proteins. Fats and carbohydrates have very, very weak links that bind those properties together to break it down into the elemental levels. Proteins are much stronger links, very, very strong links. So they require an acid to break those proteins down into amino acids. Well, amino acids are so important to our health because that's what's driving our mitochondria inside of our cells to produce energy. So you need proteins, tremendous amount of proteins, amino acids, to be able to drive energy in our body. When we don't have the capability of having enough acid in our stomach to break down those proteins, those meats, those proteins go right through your system, right out the other end. Mm-hmm. And we're not digesting food. Just because you eat it doesn't mean that it breaks down, gets assimilated into the blood system, and goes to the cells that it needs to do. So when you're taking a protein pump inhibitor or any type of acid blocking medication, you're limiting the ability for your body to actually break proteins down into the amino acid usable form in order for you to actually gain energy. So that can be detrimental to your health over a period of time. That happened to me. I went to a physician one time. I got scoped. He said, you have a little inflammation in your stomach. And I said, okay, I understand. And he goes, well, you have to take this Pepsid. I go, for how long? He goes, forever. And I go, don't you understand how it affects the proteins? He goes, what, do you want to live with reflux? That's not the answer.
Yeah.
So we're going to talk about the answers in a couple minutes.
Real interesting. We're talking about acid reflux this morning with Dr. Bob Olivieri on the Bob and Mark Show. It's coming up on 8:21. As we roll along here, of course, Dr. Bob Olivieri is in, as he always is on Tuesdays. Today we're talking about acid reflux. Every once in a while you hit one of these topics and I go, okay, I deal with that. And this is definitely one of those things that I think a lot of people have dealt with. So really interesting to get into this topic. We're just talking about, how some people just take drugs to treat it, and that's not really the answer, as we've learned a lot of times on this show.
Yeah, what's interesting is when those drugs first started coming out, the big ones were Nexium and Prevacid, and when they first came out, they were really instructed to be given only for 6 weeks at a time,
right,
because of the power of what it does and really understanding what the physiology is. That's kind of like evolved over a period of time to where, like right now, like if you watch a television commercial, I remember the one where a father is cooking sausage, peppers, and onions on a grill, and he went to stop. He didn't want to eat it, and his family goes, "Hey, don't worry about it. Here, just take this, and you'll be fine." Or what was the one, Pepsid? They hand that out at like barbecues. Like if you're going to like a county fair, they're at the outside just handing it out. They're making it seem like it's okay to do that. It's not okay to decrease stomach acid to where you're not going to digest your food. It's not okay to do that. This is vital, important nutrients that you need to survive.
I remember back in the day, real fast, just to make your point a little bit more clear, they used to have, it used to be, okay, if you get like upset stomach, you take your Pepto-Bismol, it's like after you get the problem. And now they have these drugs where they're marketing them, here, to prevent, here, take this, when you know you're going to eat garbage. And it is kind of a shift change there now. And it's like, oh man, they're just really pushing these drugs on us, aren't they?
It is, but I mean, you have to look at it from a business perspective. Nexium and Prevacid, they made usually per year $5.1 and $3.4 billion annually. $1 billion. Each one of those, like that's a lot of money invested in our poor. There's not going to be a look for a cure of this, right? Because when you treat the symptoms, it becomes profitable.
Right.
If you cure the problem, it's no longer profitable.
Right.
I for those that listen to the show, I have that bias towards a lot of different serious illness in America. We're just looking at trying to treat some of the symptoms as of actually trying to find a cure. It's not a doctor's fault at all. We're just trying to treat what we're dealt with each and every day and use the tools that we're actually distributed. But I do believe that a lot of pharmaceutical companies are not necessarily looking for the actual cause of problems, just the treatment of the symptoms.
Yeah, you're right. There's more money in getting people to keep using those drugs.
There sure is, and it is. It's a business, But now you have a lot of these things out there that are actually given without a prescription, which I don't think's good. I don't think that's a good idea, because we actually self-treat all the time. So let's talk a little bit about, in reality, what the acid-blocking drugs actually do, and we're going to talk a little bit about the actual physiology of it. So this might be a little bit boring, but hopefully not too much. We have a couple different secretions in our stomach that allow us to actually digest food. So you want to keep your stomach at a certain pH where it's going to break down things. It's going to break down those foods that we just talked about, the proteins, really important.
Yeah.
Guess what else it does? It kills all the bacteria that goes into all the foods that we're eating. So you need hydrochloric acid to kill all those bugs. Guess what? If you go ahead and you get some fruits and vegetables that may be coming from another country, they look over it pretty closely, but bugs grow during transport, so there's a lot of that stuff in there. If you're not washing your fruits and vegetables, you're digesting bacteria, sometimes parasites, sometimes a lot of other things. That hydrochloric acid kills that. So you don't have to worry about it. It protects your body. It's also responsible for manufacturing very, very important vitamins. Vitamin B12, in order so you're not to become anemic. B12 is extremely important, and that's where it's made. It's made in it's processed in the stomach, so extremely important. So you have this stuff called gastrin in your stomach that's secreted to stimulate things in your stomach called parietal cells, which makes the hydrochloric acid. And hydrochloric acid creates an environment in your stomach that's acid, that it stimulates another physiological system called your chief cells, which produces pepsin, or eventually leads to pepsin. I don't want to bore you more, but then what that does is the pepsin, from pepsinogen to pepsin, breaks down amino acids. So if you don't have that process going on, it all starts with pH, it all starts with the stomach acid. If you don't have that, you're not killing the bugs. You're not breaking down your amino acid. You're not developing the vitamins that you need to be able to do. Can you see how that is really serious stuff? Hopefully you get this. Yeah. This is really serious stuff. Your body needs B12 for multitudes of functions, which we'll talk about in a minute. But if you don't have that, you can become anemic. Yeah. If you don't have anemic, then you're not carrying oxygen to all the different tissues in your body that you need to be able to survive.
Yeah, and I have a question for you too when we come back.
Okay.
So we're going to talk with Dr. Bob Olivieri a little bit more about acid reflux this morning on the Bob and Mark Show. It's 8:30. Coming up in just a little bit, we'll have Jackie Money in here giving us a money report. Right now, we've got 50 degrees, and of course, Dr. Bob Olivieri is joining us as he does on Tuesdays, and we're talking a little bit about this, this interesting topic of acid reflux. And as we're talking here, I have to wonder. You always hear about how if you take cold medicine too much, it could limit your body's own ability to fight cold germs, because the body becomes reliant on, I know when I get a cold, there's going to be these other things that are going to be entered into my body. I wonder if taking these drugs that fight acid reflux would, if the body would become dependent on that, just hey, you know what, when I'm going to get this, I wonder if that, because if you really think about how some of these things that we take really do affect what's inside your body. So I'm really interested in what you're talking about here about, learning how to deal with this on a better way, and just taking care of your body.
I'm not sure about that. I'm not sure if your body becomes dependent on those. I do know that what they do is they block. So for as long as that you do take them, they are blocking the acid in your stomach. So and that acid, the importance of that, the stomach acid. I was just going through it a little bit, but again, digesting proteins in just normal food, but it also activates digestive enzymes in your small intestines. Remember, this is one digestive system, right? So it's important when food goes into your mouth, there's amylase in there that breaks down sugars. As it goes down the esophagus, there's acid in there that breaks down, proteins and it kills all the bacteria. But when it starts to get into the small intestines, that's really where, digestive enzymes break down food particles even more. Mm-hmm. So the food nutrients, all of those, carbohydrates, fats, proteins, can be absorbed into your small intestine to get into the blood system, to be transported all over your body, so each and every cell can get those nutrients. So that the stomach acid actually activates digestive enzymes in your small intestine. So that's a stimulating effect all the way down there. So if you don't have it, you're not really digesting all of your food. Yeah. Also, again, it can stop with the bacteria growth in your small intestines too. But it's really important about nutrient absorption. Remember, we were saying the B12 is really important, but it's also for calcium and magnesium. So what are some of the ramifications of not digesting those things? Well, you're going to get some mineral deficiencies, you're going to get some vitamin deficiencies, but you're going to lead to problems like irritable bowel syndromes, but even poor stomach acid. How many times have anybody's ever thought of this? Poor stomach acid can lead to depression, hip fractures, osteoporosis. The Journal of American Medical Association a couple of years ago just talked about, the lack of stomach acid leading to osteoporosis, because you're not getting the proper calcium digestion. God, when I was growing up, they used to say, take Tums so you can increase your calcium absorption.
Oh, yeah.
That was absolutely the most unscientific statement I've ever heard in any commercial or anything ever made. That is bizarre. Telling somebody to take something that's going to reduce acid in your stomach to get what little calcium that is in Tums, first of all, and it's not even readily absorbable because it's the wrong type of calcium, to be able to do that. That's all marketing. That's not science, and you have to be so careful nowadays of what you say, They get away with that.
Oh,
That is like the worst advice I ever get. And I remember this because I remember this clearly because I had, like 10 years ago, I had a patient came in and I said, you're pretty osteoporotic. You're taking anything? He goes, yes, I'm taking Tums. I go, you're taking Tums? Yeah, for calcium. I go, that's not, you need microcrystalline hydroxyapatite, you need, whatever, you need a bunch of different stuff, citrate, whatever, lactate, there's tons of different types of calcium. And he goes, oh, my family doctor told me that. And I'm like, there's no way in the world that had to be just like mentioned off the cuff, or there was no nutritional value there. And I believe she probably got it off the television. Well, hopefully, I personally wouldn't know any family doctor would say that, but that's what she said.
The knockoff store brand Tums right now in my medicine cabinet, and it says, you're right, they market it, and they even market it as like, if you just want to take them just for the calcium. Like, I need some calcium. Pop
terrible.
Tums. And I'm like, or whatever the store brand is, and I'm like, that's. I don't know if that's the best thing.
But even when you're talking about, we were just talking about some of the vitamin deficiencies. When you're deficient in vitamin B12, because I said we were going to get into that, it can lead to depression, anemia, fatigue, nerve damage. Even dementias have been associated in the elderly. It also can lead to overgrowth of bacteria in your stomach, which is like really, really a big deal in the functional medicine world right now. Clostridia was one of the bigger ones, which it's a life-threatening infection. So all of these types of things. If you're suffering from intestinal bloating, abdominal gas, abdominal pain, gas, diarrhea, these are really common side effects of this. And it can even lead to IBS. So who would ever think that somebody is suffering from IBS has to do with something that they're taking to reduce acid in their stomach, right? This is the world of functional medicine that I live in. This is what we talk about. You have to look at the system as a whole, and this is what the Feel Great Nate program is. Yeah. We look at the system as a whole to be able to treat the body as a whole.
Well, it's funny as you were going through that list there of some of those symptoms. I was like, wait, that's the jingle for that one popular pink liquid. Yeah, I was like, oh, look at that, the heartburn, diarrhea, all that. I'm like, wow, that's crazy.
Sad.
Right. Yeah, so we are going to continue our discussion here with Dr. Bob